Thoughts and feelings are not facts.
How dare you? Tertiary gaslighting through therapists actually can lead to re-traumatization and PTSD. Toxic stress. Constant activation of the body's stress response system due to chronic or traumatic experiences in the absence of caring, stable relationship with adults, especially during sensitive periods of early development, can be toxic to the brain, architecture, and other developing organ systems. Connections in the brain are reduced and lost through toxic stress. Less connections means it is more difficult to utilize the brain capacity and learn effectively.
Our distinguished speaker tonight, Dr. Nadine Burke-Harris, pediatrician, founder and CEO of the Center for Youth Wellness, and wonderful author of this book, The Deepest Well, The Healing and Long-Term Effects of Childhood Adversity, which we'll be talking about tonight. Dr. Burke-Harris is a pioneer in the movement to transform how we respond to early childhood adversity and the resulting toxic stress that dramatically impacts our health and our longevity. By exploring the science behind childhood adversity, Dr. Burke-Harris is offering a new way to understand the adverse effects that really impact us all throughout our lifetime. As the founder and CEO of the Center for Youth Wellness, she has brought her scientific discoveries and her new approaches to audiences around the country, including the Mayo Clinic, the American Academy of Pediatrics, Google Zeitgeist, Dreamforce, and now all of us here this evening. Her TED Talk, How Childhood Trauma Affects the Health Across a Lifetime, has been viewed by more than 3.5 million times, and her work has been profiled in The New Yorker, in best-selling books, including How Children Succeed by Paul Tough and Hillbilly Elegy by J.D. Vance, both incredible books, and also featured on CNN, Fox News, and the New York Times. Dr. Burke-Harris has been very acclaimed and awarded the Arnold P. Gold Foundation Humanism in Medicine Award, presented by the American Academy of Pediatrics, and the Heinz Award for the Human Condition. She serves also as an expert advisor to the Too Small to Fail initiative, a national initiative working to improve the outcomes for children, and as well as the National Advisory Board of the American Academy of Pediatrics.
The reason I titled the book The Deepest Well is because it's about getting to the source, right? It's about getting to the root cause of so many of what appear to be our society's most intractable problems. But the fact is that if we do not get to the root cause, then these problems will continue to seem unsolvable. But when we understand that childhood adversity is the root cause of not only so many of our social problems in terms of incarceration, problems with our educational system. How do we, we talk about underperforming schools, right? When we're talking about schools that have classrooms that are full of children who are experiencing the neurologic consequences of childhood adversity. When we get to the root and understand that, we can begin to use this science to apply strategies that are much more likely to be effective.
And you did that with Diego. And you start with this wonderful story about Diego. He's 7 years old. He couldn't be more than looking like he was as tall as 4. He was referred to you by a nurse who thought that maybe, a school nurse who thought maybe he had ADHD, if I'm remembering the story right. And you find out in your examination that he was sexually abused when he was little. I have to say, working at Safe and Sound, we see so many Diegos who come with their families for help, and they have this history of severe trauma. And you realize it wasn't ADHD that was the proper diagnosis. It was something else. It was toxic stress. Can you talk about that examination in Diego, and really you went to the root and the source of what his problems are?
Yeah, so let me back up.
Yeah.
Because I will tell you that I did, my medical school at UC Davis. I did my my MPH at Harvard, did my residency at Stanford. I got some good education, right? I did my best to get the best education I had. But I never learned in one day of medical school that childhood adversity could be the root of the health problems that I might see in my patients. But a funny thing, which is that my dad is a biochemist. He's actually here in the audience this evening. What I learned from my dad is that behind every natural phenomenon, there is a biological link. There is a biological mechanism. You just have to look for it. And so I was, when I finished my residency, I came to work for California Pacific Medical Center, and together we opened the Bayview Child Health Center in Bayview Hunters Point with a goal of reducing health disparities in one of our most vulnerable neighborhoods in the city. And over again, I was seeing all of these kids who were being referred to me for lots of different health problems. Some of them were being referred, a lot of them were being referred for ADHD, right? With cases very similar to Diego. But some of them had different symptoms. For example, a patient who was referred to me had terrible asthma, right? And as I was going through asking her mom about the asthma triggers, is it pet dander? Is it cleaning products? Is it pollen? What could it be? And this mom said to me, doctora, I noticed that my daughter's asthma acts up every time her dad punches a hole in the wall. So as I was in my practice, one day, typical day, a mom brings in her son, concerned about possible ADHD. That's what the school nurse told her, that probably he needed medications and to take him to his doctor. But when I saw this patient, he was this beautiful, beautiful child. And one of the first things I noticed about him was that he was little. He was itty bitty. And I had to double check actually the date that was in the medical chart, because although he was 7 years old, when I looked at him, and plotted his height and weight again, because even though he was 7 years old, his height was the 50th percentile for a 4-year-old. And but they were there for the ADHD, so, I asked, as I, was doing the history and physical, there were a couple things that I noticed. In addition to the fact that his mom's concerned about behavior, he also, and the fact that he was short, he also had asthma, and he also had eczema, which is, skin inflammation. And as I asked his mom about when his behavioral symptoms started, she became tearful. And I actually had to escort Diego and his sister, to wait with our medical assistant in the waiting room. And when I came back, she told me that he had experienced a sexual assault when he was 4 years old. And the way that normally as doctors we're trained to evaluate these situations is like, okay, so we've got a kid with behavior problems. That's one category, right? And I either need to, standard of care now for what we call, for attention deficit hyperactivity disorder, is to either, the number one treatment is Ritalin, is stimulants, right? And then I have this child who has asthma and eczema, and then I have this child who has growth failure, right? But as I began the evaluation for his growth failure, one of the important diagnostic piece of information is something called a bone age. It's an X-ray of the left wrist to evaluate skeletal maturity. And when I did the bone age on this patient and I got the report back from the radiologist, it said his skeletal maturity was mean for a 4-year-old. And as I was putting the pieces together, I called the endocrinologist and I said, let me ask you something, because in the back of my mind, my dad's teachings that this is all biologically connected, right? There are these mechanisms, and I have a kid who has had this significant trauma when he was 4, and his skeletal maturity is of a 4-year-old. I said, let me ask you, is it possible that this child could have experienced a growth arrest as a result of the trauma? And the endocrinologist that I spoke to said, yes. And that was really what motivated me to go down the path of better understanding, how does this happen? How is it that what our kids experience early in life can have such a profound effect on their health?
A thought or a feeling does not make it so. Being able to be aware and put it in context of what's happening in your life allows for a level of a non-attachment to the thoughts and feelings, which in turn allows for a person to better cope with the thoughts and feelings that are coming up for you.
Tertiary gaslighting is when you actually go and get professional help, and that professional therapist, counselor, or life coach, they then run the same game. They then say, are you sure this is something that really happened? Are you sure this isn't all inside of your head?
The cell danger response is triggered by environmental stressors to cause disease. Triggers are infections, toxins, chemicals, psychological trauma, physical trauma. Because chronic fatigue syndrome has no diagnostic test and remains diagnosed by symptoms that cannot be objectively measured, many doctors and other health care professionals still believe it is psychological and not a real disease. Many with chronic fatigue syndrome have been or are still told their illness is all in their heads, caused by mental health conditions such as depression, or that it is faked due to malingering or trying to get attention caused by a personality flaw or unhelpful beliefs, and more. Findings such as those delineated above, new studies in epigenetics and other fields of study, and metabolic abnormalities identified by Dr. Navio in the study presented explain how this perspective is inaccurate and out of date. The PACE trial graded exercise, GET pacing, and cognitive behavioral therapies, CBT, became the single dominant treatment recommendations for chronic fatigue syndrome by the medical profession. While these approaches can be supportive in the management of life with any chronic illness, exercise is a characteristic trigger of flares and worsening of fatigue and other symptoms of chronic fatigue, and together with CBT inaccurately suggests the underlying cause of CFS and other diseases are psychological, psychosomatic, or functional. These recommendations thus elicit an appropriate response of concern, anger, disbelief, and distrust by people with chronic fatigue syndrome, and rightly so. Navio findings and trauma theory presents a very different understanding and recommendations of chronic fatigue syndrome. The science of traumatic stress, neurobiology, epigenetics, and more demonstrate that subtle and overt types of trauma and adversity directly alter physiology, cell function, metabolism, immune and nervous system function, and other organic and biological activities to increase risk for autoimmune and other chronic physical diseases. There is increasing evidence of critical mast cell involvement in chronic fatigue syndrome, fibromyalgia, depression. So, it's not all in your head. Because the mast cells have many triggers. So, not just weather changes, it can also be stress. There are studies on that. Mast cell activation by stress. Mental or emotional stress, as well as physical stress, has been shown to cause mast cell degranulation in several different tissues. Several lines of experimental evidence indicate that stress working through the sympathetic nervous system or the hypothalamus pituitary adrenal axis stimulates peripheral nerves to release neuropeptides that bind to receptors on the mast cells, causing them to degranulate. Stress-induced intracranial mast cell degranulation, a corticotropin-releasing hormone-mediated effect. From 1995. Stress is known to precipitate or worsen a number of disorders, such as migraines, in which mast cells are suspected of being involved by releasing vasoactive, nociceptive, and pro-inflammatory mediators. However, no functional association has been demonstrated yet between a migraine trigger and brain mast cell activation. Non-traumatic immobilization, restraint, stress has been shown to stimulate the hypothalamic pituitary adrenal axis and to cause redistribution of immune cells. Here, restrained stress caused degranulation in 70%. This is the first time that stress is shown to activate intracranial mast cells, apparently through the sequential action of CRH and sensory neuropeptides. These findings have implications for the pathophysiology and possible therapy of neuroinflammatory disorders such as migraines, which are induced or exacerbated by stress. Another study from 2004. Mast cells are critical players in allergic reactions, but they have also been shown to be important in immunity and recently also in inflammatory diseases, especially asthma. Migraines are episodic, typically unilateral throbbing headaches that occur more frequently in patients with allergy and asthma, implying involvement of brain mast cells. These mast cells are located perivascularly, in close association with neurons, especially in the dura, where they can be activated following the trigeminal nerve. This is the only image I could find, but when you click on the link it says page not found, so sorry it's so small, but you can still read it. Mast cell triggers, and it's very close to the trigeminal nerve. Mast cells in stress, pain, blood-brain barrier, neuroinflammation, and Alzheimer's disease. Mast cell activation plays an important role in stress-mediated disease pathogenesis. Chronic stress cause or exacerbate aging and age-dependent neurodegenerative diseases. The severity of inflammatory diseases is worsened by the stress. Mast cell activation-dependent inflammatory mediators augment stress-associated pain and neuroinflammation. Stress is the second most common trigger of headache due to mast cell activation. Modern life-related stress, social stress, isolation stress? Well, for autistics it's a bit different. It's probably socializing stress, restraint stress, early life stress, are associated with an increased level of neurotoxic beta-amyloid peptide. Stress increases cognitive dysfunction, generates amyloid precursor protein, APP, hyperphosphorylated tau, neurofibrillary tangles, NFTs, and amyloid plaques, APs, in the brain. Stress-induced beta-amyloid peptide persists for years and generates APs even several years after the stress exposure. Stress activates hypothalamic pituitary adrenal HPA axis and releases corticotropin releasing hormone, CRH, from hypothalamus and in peripheral system, which increases the formation of AB. Tau, hyperphosphorylation and blood-brain barrier. Disruption in the brain. Mast cells are implicated in nociception and pain. Mast cells are the source and target of CRH, corticotropin releasing hormone, and other neuropeptides that mediate neuroinflammation. Microglia express receptor for CRH that mediate neurodegeneration in AD. However, the exact mechanisms of how stress-mediated mast cell activation contribute to the pathogenesis of AD remains elusive. Introduction. Stress is our body's normal physiological response to any adverse changes in our environment to deal and overcome these challenges. Chronic diseases can disrupt the quality of normal life and day-to-day life activities that can lead to physiological stress. Stress induces the onset and progression of pain, cognitive disorder, and psychiatric disorders. Stress induces diseases, and the disease in turn can exacerbate the stress severity in a vicious cycle. Chronic stress due to continuous wars, military service, chronic diseases, dementia, neurotrauma, poor sleep habits, immobilization, isolation, noise, high workload, unstable job, annoying work environment, difficult spouse, acute stress due to emotional, social, environmental temperatures, hot and cold, odors, certain foods, new challenges, competitions, presentations at work, and intermittent fasting can induce several unwanted changes in the central nervous system. These changes include cognitive disorders, neuroinflammation, altered secretion of growth factors, high pro-inflammatory cytokines and chemokines secretion, increased oxidative stress, blood-brain barrier disruption, ultra-structural and molecular changes in tight junction means leaky gut, neurovascular unit, gliovascular unit, changes in the brain volume, and neuroinflammation. Stress can also induce the changes in the peripheral system, in the central nervous system immune components, and affect immune cells such as mast cells. It wasn't until I left medicine in hopes of better understanding the root causes of chronic illness that I learned what trauma really was. Two experiences made all the difference. First, when I retrained as a somatic trauma therapist and was introduced to research I'd never heard of in my medical training. Second, when I developed a chronic illness myself. At my worst, I became almost entirely bedridden for 9 months from chronic fatigue syndrome. There's nothing like living with the disease to truly understand what it's like. The vulnerability, the fear that a symptom might be life-threatening, the sense that you might keep worsening until you actually die, and no one will be able to help you. The side effects, the frustration and desperation when nothing works, as well as the loss of social connections and work and income and so much more. Trauma is caused by experiences of relative helplessness. Trauma can be defined as any event that triggers relative helplessness. A car accident, a scary medical procedure, a sudden death of a loved one, being given a diagnosis of an incurable disease. Such events trigger the same pathways in the brain as do abuse, rape, or war. Anxiety and depression are common effects of trauma. You don't have to develop PTSD to know you've experienced trauma. Two of the most common symptoms of trauma are anxiety and depression. These conditions occur frequently in people living with chronic illness. A lack of trauma awareness means that many healthcare professionals treat anxiety or depression as their primary approach in our diseases, thinking these are the cause. They believe our illnesses are all in our heads. Trauma science, on the other hand, explains how these symptoms can be caused by chronic diseases themselves, and from painful, frightening, unpredictable symptoms for which there are few or no treatments. Past trauma can cause chronic illness, anxiety, and depression. Anxiety, depression, or chronic illnesses of all kinds can be caused by adverse childhood experiences, ACEs, multi-generational trauma, and institutional trauma, such as discrimination due to race, religion, sexual orientation, and if you are autistic, you experience stigma and therefore trauma as well. The research explains how trauma is a risk factor of all of these symptoms. It also explains how the effects of trauma are not because we're weak, but because adverse life experiences interact with our bodies, brains, and physiologies to shape long-term health. The view that chronic illness is psychological is false and out of date. If you have a chronic illness and your doctor knows you have a history of trauma, they may have told you your symptoms are psychological or all in your head. This may have happened if you have an illness that can't be diagnosed. This all too common perspective is traumatizing, as well as inaccurate. It has also been disproven. The science of epigenetics is revealing that life experiences influence the way our genes function and the degree to which they turn on and off. Medical care is often traumatizing. Being disbelieved, judged, shamed, or told that a complaint isn't real is a form of abuse. That's tertiary gaslighting when it happens from professionals. When the social worker snickers behind the hospital curtain or a nurse whispers outside the office door that our inability to eat or get to the bathroom is due to laziness or faking it, this is also a type of trauma. Medical procedures that are scary or pose actual threat to our bodies or our lives are also potential sources of trauma. These are routine experiences for people living with chronic illness. The fact that these events are common, however, does not make them benign. Triggers are indicators of past trauma. The act of scheduling a medical appointment, going to a hospital, or having a procedure often triggers flare-ups or setbacks for people with chronic illness. We may develop brain fog, feel shaky, or have trouble sleeping before or after such event. Yeah, for me, I can get migraines afterwards or a meltdown even after the dentist. Or feel completely exhausted, drained to the bone, things like that. And it takes me a day to recover. Sometimes we avoid doctor visits altogether, despite the possibility our symptoms may get worse. We can also have flares, even if we've gone to help a family member rather than ourselves. These kinds of behaviors and bodily responses are evidence of more than simple stress. They are normal indications of unresolved trauma. It's common to become more sensitive to medical environments over time as our exposures to difficult events accumulate simply because we have a chronic disease. This is an often overlooked reason why events that seem ordinary and we feel we should be able to easily cope with can act as trauma triggers. Brain mast cells can also secrete pro-inflammatory and vasodilatory molecules such as interleukin and vascular endothelial growth factor, selectively in response to corticotropin releasing hormone, a mediator of stress, which is known to precipitate or exacerbate migraines. A better understanding of brain mast cell activation in migraines would be useful and could lead to several points of prophylactic intervention. When a professional, a therapist, who claims that he or she are an expert, but then completely invalidate you, it makes me so furious. Invalidation trauma. Being invalidated is actually a threat to your nervous system. So the natural reaction will be fury, rage. But then you can also, unfortunately, get into the freeze state and feel depressed by being invalidated. Here is the fight and flight, and here is the freeze or fawn. Choose to see the whole elephant, not just parts. As an autistic, social interaction actually very quickly will exhaust me, and I will feel tired to the bone, and my mast cells will react to the stress by releasing histamine and cause symptoms like fatigue, fibromyalgia-like symptoms, back pain, migraines, or anxiety, sadness, dread. The longer the social interaction is forced upon me, the more I will feel drained, and I will even get into a state of shutdown, the ultimate freeze, and stop interacting, stop moving, stop talking. It has happened. It's almost catatonic. And that's not in my head. That really happens. It's very real. The physical pain as well as the mental and physical exhaustion.
Are you sure this isn't just your perception of what happened and not what really happened? Or they'll say to you, patronizingly, well, we can't talk about what really happened. We can only talk about your perception of what happened. Which is like, well, what the fuck does that mean? Are you saying that my perception is faulty? Can I not see reality? Is the sky not blue? Is water not wet? Why do we have to talk in this weird relativistic way that puts the victims back in the soup? It puts them back into this thick soup that they can't quite swim through, but they can't also quite crawl out of, and they're doing it without the little life circle.
If you receive no support from your therapist, if you experience invalidation, this is traumatic. And if this happens repeatedly, you can indeed get into a functional freeze from the stress that is caused by the invalidation from a person you trusted and expected support.
Tertiary gaslighting is less forgivable. It can also be malignant, which you have to watch out for. But tertiary gaslighting is coming from a professional. It's less forgivable. It's no longer going to be a thing that I say that it's okay for counsellors and psychotherapists to just not read. That's on you. That's a lack of due diligence. That's a lack of professional care. It's not an excuse anymore. Documentaries are being made about it.
There, even in the Wikipedia you can read it. 20-year-old study, Adverse Childhood Experiences Study. It's a research study conducted by the U.S. health maintenance organization Kaiser Permanente and the Centers for Disease Control and Prevention. 2-year-long study. The study has demonstrated an association of adverse childhood experiences and disease.
A child's experiences early in life are important building blocks for the developing brain. Genes, nature, are like the blueprint. They provide the basic framework for brain development. However, genes do not design the brain completely. Environmental influences, nurture, fine-tune how the brain works by shaping which brain connections get used. Connections that are used more grow stronger and more permanent, whereas ones that do not get much use fade away. Together, genes and the environment build the foundation for all future development,